hello. It's Dr. Michelle. We are starting in about 2 minutes. I jumped on maybe a few minutes later than I wanted to, but we are all here. Happy Friday. I'm excited to talk to all of you guys and answer all the questions that you have, but it's Friday night. It's casual. I have no slides. I have no agenda other than just to answer questions, spread some information about menopause and perimenopause and hormone replacement therapy and all these things that maybe don't get talked about enough. Although I am super excited to see more and more press being given to menopause and perimenopause. You might have seen celebrities like Halle Berry was just in the news yesterday for supporting a bill in Congress to have more menopause and women's health education and more research into hormone replacement therapy and all of that. So that is pretty awesome. Super excited about that. So happy Friday. We are here and talking about hormones. All right. So I see I do already have some questions in the Q&A. I see I have some chat. So hi, Ramona. If you want to just say hi in the chat and let me know that you're here and maybe like how you found out about the Q&A. If maybe you watched one of our master classes this week, we had tons and tons of women going through watching about hormones and hormone replacement therapy. So that was pretty awesome. And then I just want to just let you know that one of the reasons why I'm hosting this Q&A is because we had such a huge response to the masterclass this week. We had a few of them running and we did not get to all the questions that were asked. Like they were just rolling in and I tried to answer as many as possible. And then I have a team that has been like furiously trying to answer questions, but we did not get them all answered. So I thought, what better way to answer questions than to do it live on a Q&A? So super awesome. Very excited. So Ramona, I see you have a question in the chat. I saw, but I think that it's still going to take a long time for MDs to change their stance on hormone replacement. Yes, it's pretty much like the story of the boy that cried wolf, or when people used to think the earth was flat. Anytime you are told something over and over and over again, and that's to be true, it's very hard to now present information to prove that otherwise. And I find that like younger doctors tend to be more open to changes because we're used to that, right? As we go through time, every like 1, 3, 5 years, we are learning so much more than we used to know about the human body, about biology, about genetics, about how things work. And so if you're just going to set in stone like what you learned in the 70s or the 80s or even the 2000s, you're going to not be serving your patients. So I think that there's going to be a lot of doctors that will still believe that hormones are bad for you, which is crazy because these same doctors are the ones that are handing out birth control pills like candy, and birth control pills are the synthetic bad for you hormones. But that same doctor will give a 19-year-old girl birth control pills because she has anxiety. And then a 55-year-old woman will come in with symptoms of menopause and he'll say, no, you can't have hormones. So it's absolutely nuts. But I think the more and more we all talk about it, the more and more we have celebrities. We have lots of other companies who support women's health are pouring like tons of money in, tons of investors. We got Drew Barrymore. We've got so many people, Jennifer Aniston, Michelle Obama, Oprah. Everybody is now like saying, hey, we're not going to just let this stand idly by. It wasn't really until 1993 that they actually had to test women, like use women in clinical trials. So all the drugs that are on the market that were created before 1993 were only tested on men. So women's health is really coming a long way in the last 20 years. And then in the next 20 years, I think it's going to come even further where we'll have equal and even maybe more say in the healthcare space. Awesome. Perfect. So I'm going to go ahead over to the Q&A. And then I did pull up a list of the questions that were sent in that I did not get to. So I'm going to go back and forth. If you're here, I'm definitely going to answer your question. And then if it was sent in previously, I will go over to those as well. Let's see. Renee says, I just got Vagifem. The warnings scare me too much. So Vagifem does have some synthetics in it, but it is vaginal. So there's very little vaginal estrogen that's going to go systemic. If you're worried about it or it doesn't sound good to you, definitely go with your instincts. I think our instincts are really important. So if there's something that you're like, I don't like the way this sounds, we do offer a non-toxic, natural vaginal estrogen called Glow Below in our practice. And so that's something that you can use instead if you want a vaginal estrogen. Or our hormones in Healthy Hormone Club are all natural, no chemicals in them at all. There's something that, so you do have options. So if you don't like one option, you can definitely find another option. There are bioidentical, natural options available. Let's see, I emailed a specific question, how prometrium impacts small bowel motility. So progesterone in general, and prometrium has progesterone, it's a progesterone, oral progesterone. So progesterone in general does impact gut motility. Too much progesterone can sometimes cause loose stools or diarrhea, and then too little can sometimes cause not being able to move your bowels. So having the right balance of progesterone can be just right. Now, if you do have diarrhea or constipation, does that mean it's progesterone's the reason? Not necessarily. There's many reasons for that, but sometimes if your dose is too high, or if you are taking an oral progesterone, you might want to switch to a different route if you're getting gut issues from it. But progesterone does impact gut motility, so it's actually helpful for a lot of women to have their hormones replaced, because as they get into perimenopause and menopause, a lot of times gut issues can happen, or even like during your cycling years when you're still in your reproductive cycle and you're still menstruating. A lot of times you'll see, like, right for your period or right during your period, you get like the digestive mess ups where you'll get like period poops and then you'll get constipation. And that's the changes in your hormones. So yes, it does. There is definitely a connection there. And it's depending on whether it's positive or negative for you. If it's negative, possibly dose changing or maybe changing the type of progesterone that you're using. But if it's something that you're looking for help with, and you think that's going to help, it might do the trick. So hopefully that answers your question. Let's see. What is your recommendation for vaginal internal dryness? In our practice, we actually have a product that I've actually formulated myself called Glow Below, and that is for vaginal dryness, for internal, external use, and for urinary tract infections. So it helps with the whole urogenital tract. So basically your urinary tract, your vagina, which is the whole inner part, and then the vulva, which is the outer part. So it's used both inside and out. And so that is our recommendation because it's our product, but there are also other vaginal estrogens that are available by prescription from your doctor that are also really great. So I am a huge fan of vaginal estrogen, definitely. Let's see, I'm 54. I'm having monthly cycles on and off, a few days here and there. I had uterine artery embolization for a very large fibroid. See, I recently had endometrial biopsy that showed hyperplasia with atypia. Endometrium. When I'm just reading it because it's very in depth, and this is not exactly a HIPAA compliant platform, so I don't want to give all your personal information, although I'm not identifying who you are. Let's see. I'm just reading it real quick. Okay, this is more on that same. Let's see. The research I have reviewed shows that progesterone impedes GI motility. Actually, that's not exactly true. Progesterone could actually help GI motility. It depends on if you have the right amount. See, I went through a 6-year struggle at SIBO, and now I'm feeling normal. Okay. The root cause of SIBO for me was post-infection IBS. Okay. A result of food poisoning. Okay. There's a result. Oh, this is a long, all right. So this is not exactly the format for like in-depth health, giving me your whole health history, because I can't really give you legitimate medical advice here. But it looks like your gut motility issue is not due to progesterone, it's due to gut infections and other things. I don't believe progesterone, if you're taking it in the right amount for you, is going to impede your gut motility at all. And you can use topical progesterone. That's going to give even less impact on gut motility than oral. So that's an option for you if that helps. See, my naturopath told me you do not need to retest hormones every 4 months. That's true. You don't need to test your hormones ever. No, you never ever need to test your hormones. But if you want to just make sure things are optimal and you want to see what needs to be tweaked, and if you want to just verify that you're not taking too much for yourself, there's nothing going on that's weird, there's nowhere we can improve them. We test hormones just as a backup, and then we also analyze your symptoms in depth, like 77 symptoms at the same time that we're testing. So you don't have to test hormones. Absolutely not. You don't have to take hormone replacement either. It's all like what you want and what's optimal. We include the testing for free inside our program. It's not like there's an additional expense to test, but I definitely think that everyone should test at least once in the beginning. And then I would say at a minimum every 6 months, just to make sure, because we have had women that come in and we test their hormones and they have abnormal hormones for their age. And then we are able to investigate deeper. And some of them have had a tumor, some of them had early stage cancer, some of them had other issues going on. And we were able to identify those issues because we tested their hormones. I think it's like really important to do some diagnostics, especially if you're looking to anything you're looking to optimize. In my opinion, you should be testing. It's not the be all end all, so you don't have to test your hormones. In conventional medicine, the standard of care is not to test women's hormones, but to test men's hormones. So that will all change. That is why Halle Berry had that legislation passed. This is why there's so much support around women's health and fairness for women, because yes, our hormones are important and they should be tested. So hopefully that makes sense. Let's see. I'm an active 72-year-old postmenopausal woman. How can bioidentical hormone replacement be of benefit to me? If you've never done hormone replacement before, or even if you have, every year that you are without estrogen specifically, your bones get weaker, your blood vessels get weaker, inflammation increases, your brain can start creating more plaques. You have a higher risk of all-cause mortality. That means dying for any reason. There was just a huge study that came out that I shared with my list, which is a study done on women 65 years and older on the benefits of hormone replacement therapy. And they actually found it reduced the impact of 7 different types of cancers. It reduced the effect of Alzheimer's. It reduced heart disease, cognitive decline, inflammation, all types of other health issues. So even if you have no symptoms, it is just about optimizing health. So yes, there are plenty of benefits. And if you want to, I don't know if you're on my email list, but it was like a couple weeks ago that I sent that study out, but I will go ahead and post that with this replay. So I'm just going to make a note when I send this replay out to you guys so you can see that study, the HRT safety study for women over 65. I'm just going to write it down so I remember. Over 65. Awesome. So yeah, there's tons of benefits. Let's see, are the hormones and HRT different from oral progesterone, estradiol? Yes. So in the Healthy Hormone Club, we use bioidentical topical hormone creams, and we use bioidentical micronized oils and the sublinguals. So those are the options inside the Healthy Hormone Club. So they're different than what you will get a patch. We don't actually use patches in the Healthy Hormone Club. The reason being is just because patches are okay. Just we see a lot of women have sensitivity to the adhesive, and I like to do everything as natural as possible. And the adhesive has a lot of chemicals in it, so I just prefer the creams and the sublinguals and the oils. So they're the safest. They are the most received among most women. So that's what we use in the Healthy Hormone Club. Okay, let's see. Oh, it's going too fast. If you're already on hormones and you're doing well, I recommend you stay on your hormones that you're doing. There's not only one way to do hormone replacement. If you're already on hormones, you're happy with your hormones, you feel great on your hormones, I celebrate you and I want you to be in our community. And I want to definitely be part of our party here, but you don't have to join the Healthy Hormone Club if you already got what you need. The Healthy Hormone Club is to make it accessible for everybody. And those who want some additional support, we also have holistic lifestyle coaching inside the Healthy Hormone Club. We're going to coach you on nutrition, follow along workouts, pelvic floor health, mindset, all of the above. So things like that, which you might not be getting that from your primary care physician, whoever's prescribing your hormones. But if you're already doing well, then you're doing well. You don't need anything else. I saw my primary care doctor yesterday and I told her I was going to start bioidentical hormones. She told me I was increasing my risk of breast cancer, stroke, cardiovascular disease, and made me nervous. Okay, your doctor, unfortunately, is getting her research from 30 years ago and referring to a study that has been since debunked. Your doctor is referring to a study that is on synthetic oral horse estrogen and synthetic medroxyprogesterone acetate. So a synthetic progestin and an oral horse estrogen. That is what has been found to cause negative impact, but not even breast cancer. Even those studies show that decrease breast cancer. Unfortunately, that's your doctor is one of those doctors that is not paying attention to the research and with the hormones that we use today and is still living in the past. So I just suggest you find a different doctor who actually is knowledgeable in hormone replacement therapy. And now, unfortunately, it's only like 20% of doctors in the United States have any training whatsoever on menopause, perimenopause, or bioidentical hormone replacement. And even they did a survey, it's 4 years back, of all the OBGYNs in the country. And most women, and I thought this for many years until I went through school, that your OBGYN is your women's health expert, right? That's what we think. And OBGYNs, what they train in school is delivering babies. And they actually don't have training on menopause or menopause hormone replacement therapy. And when they were polled, so they actually polled the OBGYNs, like thousands and thousands of them across the country, and they actually said that they do not feel that they have the training to help women in menopause because it's not given to them in school. And so just because like you like your doctor is good at other things, they may not be good at hormones. And so the fact that they said that hormones increase your risk of breast cancer, stroke, and cardiovascular disease, and you told them you were going to be on bioidentical hormones, that just means they don't understand. Unfortunately, that's a sad truth about a lot of doctors. And that's why a lot of women are suffering unnecessarily. And that's why we have these little Q&As. And that's why we do a lot of education at Glow Natural Wellness. Awesome. Can you please talk more about heart health and starting HRT after 60? I had menopause at 50. Can it cause more palpitations? Okay, so that is a great question. So oral estrogens can cause palpitations because so let's break this down. So when you are hit menopause and you are living without estrogen, this causes inflammation. And so inflammation goes up when estrogen goes down. So for every year you don't have estrogen, you have some inflammation start. And then that can actually start to cause little plaques to form in your arteries. So now here you are at 60. It's been 10 years without estrogen. And now you have little plaques in your arteries. So should you start hormone replacement, oral estrogen that has to be metabolized through your liver, that is going to give off these enzymes called MMP9. So MMP9 goes into your system because you took the oral estrogen and there's a byproduct of the metabolism, and that can cause those little plaques to start breaking off. And then that can cause issues, palpitations, stroke, all types of issues. If you're going to start hormones after age 60, after not being on hormones, you want to use topical bioidentical estrogen. And what happens, one of the symptoms of low estrogen is palpitations. It's actually one of the number one reasons why women call the emergency room or that they visit the emergency room for women over 55 is they think they're having a heart attack and they actually have low estrogen causing palpitations. Yeah, so the answer is yes and no. So yes, if you take oral estrogen, this can cause more problems, but if you take topical estrogen, this will cause less problems. And this was actually also talked about in the study that I'm going to share with you guys with the replay on the benefits of bioidentical hormones after age 65. And then I also had a YouTube video that I did recently on my channel. So if you guys are familiar with my YouTube channel, it's Fix Hormones with Dr. Michelle. I should actually post on it more, but I post on it when I can. A YouTuber, right? So I do when I can. I'll make a video, and I did make a short video about hormones and heart disease. So some of the misconceptions, and I included a study in there as well. I try to back as much things I say and post up with the studies, because there's always going to be a doctor that says, oh, no, I heard differently. But I'm not always able to do that. Sometimes I just want to get information out, but I do it as best I can. Awesome. What is the name of the natural product you mentioned? It's called Glow Below. So our company, Glow Natural Wellness, we put the word glow in a lot of our products. It's called Glow Below, right? Because you're going to glow from down below. And you can find it on our website. We have a version with estrogen, and then we have a version with DHEA. Why do we have two versions? People ask that all the time. Two reasons. One, because some people are scared of estrogen. DHEA will actually convert to estrogen in the body and have a similar effect. But also DHEA, when used vaginally, does help a little bit more with sensitivity, with sexual activity. So that's like the nighttime formula, and the estrogen is a daytime formula. So similar to your face, you have a day cream and a night cream. That's what I did for your vaginal tissues, because we all know, like, you need to moisturize your face, you need to put serums on. We all have a routine for our skincare, but we have very sensitive skin in our vaginal and vulval area, and we don't do anything for it. And then we're surprised when it's dry, itchy, cracked, burning. And so that's what Glow Below is for. It's skincare for down there. So that's what it's called. And we can put, Jen, I don't know if you want to put a link in the chat to Glow Below so people can see the page. You can read all about it and see, and it's available over the counter without a prescription. And you don't have to be in the Healthy Hormone Club. You can just buy it. Each bottle lasts 3 months, so it's a great value for the price. Okay, let's see. The questions are scrolling very fast, so I'm going to try to get through all of them. All right. Found you through intense research online. Thank you for advocating for women. You are welcome. My OBGYN insists it's not necessary to test hormone levels. Okay, yeah, I don't know if this is the same one. No, it's a different question. Just to test my symptoms. You can totally go by your symptoms, and we do that also. So whenever we do a test, we actually ask you to evaluate 77 symptoms. And I just think, again, like the big picture, it's actually really helpful to test hormones. Now, why do we test in saliva and dry blood spot as opposed to blood? When we're using topical hormones, they actually do not hang out in the bloodstream. They go straight into the tissues, and then they also travel in the lymph. So in order to actually see the levels of topical hormones, we want to test either capillary blood or saliva. And saliva is really easy for people because you just have to spit in the tube. Capillary blood requires you to puncture your finger. It's a little scary for people. And then also sometimes you can contaminate it if you're rubbing creams in with your fingers and you're also puncturing your finger. It's very accurate. And it's just a guideline. We just want to see where the ratios are. It's not going to be like, we're not going to treat your test results. I don't think anyone should ever treat test results of any kind. We always want to look at your symptoms, but it's always a good idea to have that guideline just to see how things are doing and see how you're absorbing the hormones, see how you're doing, see how your ratios are. So I think it's a good idea to test hormones, but it's not the be all end all. Okay, awesome. Yeah. And then, but if you are not on hormone replacement therapy and you're just wanting to know what your hormone levels are, you can totally get a blood test and see what your serum levels are. That's absolutely fine. If you start using topical hormones and you do a blood test, it's going to look like you're not using hormones. Same thing like for like urinary metabolites. It's not going to look like you're using hormones, even though you can use them a lot. That's why I've had some women come in on ridiculously high doses of hormones because their doctor is using blood to test their hormones and they're using topical hormones and they're not showing up. So that can be like a reason why you're overdosing. Let's see. Can you talk about cholesterol rising in menopause, even though you have been doing all the right food resistance training for decades? No issues with stress sleep. Yeah, unfortunately, I mentioned how when estrogen drops, inflammation increases. Same thing with cholesterol. So cholesterol is actually made by your liver, right? Your brain is made of cholesterol. It's not necessarily a bad thing. The reason why our body makes additional cholesterol is to use it like a Band-Aid. So if you have like damage to a blood vessel, your body will make some cholesterol and cover that damage up. And what happens is as we have higher levels of inflammation, our blood vessels get more damaged and needs more cholesterol. And then we get all these little patches inside our blood vessels. like all these Band-Aids stuck on top of each other. And then what happens, we start to get blockages. And then we have it looks like we have arteriosclerosis, and that's when we have higher cholesterol levels, which can cause damage later. And it's not your fault. And it's not necessarily that you're not eating well enough or you're not exercising. A lot of times it is just a result of the estrogen declining. So it's not a magic pill though. So it's not like the minute you start using estrogen, your cholesterol numbers are going to come down. It's not the same. It does take a little more time. And there's also other like downstream effects. So because your inflammation is increasing when your estrogen declines, you're more sensitive to everything. You're more sensitive to sugar, you're more sensitive to toxins, and all of these things can combine together to cause your cholesterol to go up even more. And there is some genetic factors as well. So some people in their families will have higher levels of cholesterol. So if that's you, if your mom has high cholesterol and your aunt has high cholesterol, then you're more likely going to have that issue, especially if you're not replacing hormones. How long does it take to feel results on starting the hormone creams? It's going to be different for everybody. We have some women that day one, they feel the results. And then we have some women that takes them a little bit of time. It may take them a few weeks, up to 6 weeks. So by 6 to 8 weeks, you should be feeling some benefits, but it's going to be about 3 months before you see all the benefits. And then even then, things like bone density, that's going to take a year of being on hormones to really see a difference in a DEXA scan. So everything's a little bit different. And it also depends like how healthy you are in general. If you are overweight, you have a bunch of different health conditions, and then you're taking hormones, you might not notice that much difference because you have a lot of other things going on. So it really depends. But if you want to get maximum results, following the nutrition guidelines, they're simple. It's not like you have to follow a meal plan. We give you like certain guidelines to follow, incorporating some strength training, drinking water, doing some stress reduction. All those things are going to help your hormones work better. If you're already living a pretty healthy lifestyle, you might just want to also just make sure that you're checking the boxes, because a healthy lifestyle in your 20s looks different than a healthy lifestyle for menopause. Like we can get away with a lot more in our 20s than we can in our 50s. We're not as responsive to certain things, we're less resilient to stress. Sugars and fats and toxins affect us more as we age. And so just like doing the holistic lifestyle along with the hormones will help things to work better for sure. What's the difference between estriol cream and estradiol cream? Okay, so estriol is a very weak estrogen. It helps with like moisture, but estradiol is the one that does all of the things. So estradiol is for your bones, for your brain, for your heart, helps with collagen production, your skin, helps reduce inflammation, the cholesterol, blood sugar, helps with satiety. One thing that people don't realize is what estrogen is actually a GLP-1 antagonist, similar to if you've heard of Mounjaro and Ozempic, all those weight loss injections. Estrogen actually does the same thing, just at a smaller extent. This is why when you look at pictures like from like the 20s and 30s and 40s of like families, and there's always like grandma, and everyone's like skinny, like all these black and white photos, even everyone in the family is skinny except grandma is a little bit chubby. It's not because grandma's eating more, it's because her hormones are declining. But so estriol it's not very active, but combined together, estriol and estradiol, they do work well together. So we usually, when we're looking at hormone cream dosing, we're always dosing the estradiol and then we're adding in some estriol as a little helper, because in the body, you get both. Come in. We have the Prize Patrol here. So let's see what's happening. I'll interrupt this announcement for the Prize Patrol. Hello, Paxton.
Hello.
Okay, so if you've been here before, you know that Paxton comes in and interrupts our Q&As so that he can give out prizes. Oh, we got some cool prizes today. We have these little Glow Getter water bottles. They're glass, frosted glass with some bamboo. So we have 2 of these that we're going to give away. And then we'll give away a bottle of Daily Glow, right? Okay, cool. So I don't want to drop these because they're glass. Okay, so who's going to win the first water bottle? Oh, we're going to ask a question. Okay, so how it works is Paxton is going to ask you a riddle. And then in the chat, not the Q&A, but the chat, you are going to answer it. And then Paxton's going to see the first person that answered it correctly. All right, so there is a little delay here. You want to sit down? Okay. All right, so are you getting ready? Okay, we are ready. Kimberly says hi. All right, okay, we got some riddles. All right, which one are we going to do first?
What is a plumber's favorite vegetable?
Okay, what is a plumber's favorite vegetable? This one's a little bit hard because I didn't know it earlier. Okay. Oh, nobody's got it yet. It's a little hard, so it's not a very common vegetable. Oh, okay, this person must be. All right, is it Donja, Garrett, or Donia? Oh, I'm probably saying it wrong. Donia, maybe it's like Sonia, maybe. So Donia Garrett, you are the winner. You said a leek. So plumber's favorite vegetable is a leek. And you're gonna get a Glow Getter water bottle. All you need to do is email support@glownaturalwellness.com. Say, I'm a winner of Paxton's Prize Patrol, or just say you won the water bottle, and we will get that sent to you. You need to give us your address though. So we need an address where to send it. Awesome. Oh, you raised your hand. Let's see if we can. I don't know how to unraise the hand here. Let's see. We're not going to do the raise hand, but if you want to chat something or Q&A it to me, that's awesome. But I'm not able to unraise the hand here today. All right, we go and do the next one. Oh, so yeah, send your address. So if you win, you're going to send your address to support@glownaturalwellness.com, and just in the email, just say I won the Prize Patrol. All right, awesome. Jen, can you just write down who wins what for me? Perfect. Awesome. Thank you. All right, next question, Paxton. Are you guys ready? Get ready. Trying to lean on this. All right, go for it.
What do you call a cow in an earthquake?
All right, what do you call a cow in an earthquake? Oh. All right, she can't when she works for us. All right, the winner is, oh, you gotta be fast for these too. Wait, but there are ones above here. Oh, yeah, this one. All right, you're abbreviating your name with the letter N, the letter V, like Nevada. So NV, you won, and you are just going to go ahead and you are going to send your address to support@Glow Natural Wellness. And you also won a water bottle, beautiful frosted water bottle. It says Glow Getter on it because it's like Go Getter, but Glow Getter. All right, next one is going to be for a bottle of Daily Glow. Last prize. Here we go.
What did the paper say to the pencil?
All right, what did the paper say to the pencil? All right, you guys ready? What? Oh, whoa, this is really good.
The first one.
Yeah, Carrie Lesher, that was awesome. Carrie Lesher, you won a bottle of Daily Glow. I can't reach it to show it to you, but maybe you know what it looks like.
You even got the exclamation mark.
Yeah, you got it right down to the exclamation point. But there's some good answers. What's the answer in number 2? Get a grip, get the lid out. Those are all good answers. All right, so awesome. So Carrie, you want a bottle of Daily Glow? Just go ahead and email us at support.
By the way, the answer to number 2 was a milkshake.
I feel like we should.
Not a milkshake, a milkshake.
Okay, so okay. I think that Paxton, we should put a question in the replay. Should we put a question in the replay so they can have a second chance?
Yeah.
All right. We're going to put another question with the replay so you guys have a second chance. So look for a question for us. Thank you, Paxton.
I'll be right back.
Not right now, when we send the replay.
I'll be right back. Next Q&A. That's what I meant.
Thank you. Awesome. Thanks for your services. We enjoyed it. And I have a question for
the services I don't have except for Prize Patrol.
You're the Prize Patrol, that's right.
I am the Prize Patrol. I don't work for the Prize Patrol. I am the Prize Patrol.
That is correct. Awesome. Thank you very much, Paxton.
Bye.
Bye. Awesome. No, if you live outside the United States, we will ship it to you. So if you're a winner, and no matter where you live on planet Earth, we will ship that to you free of charge. You do not have to buy anything. This is just for fun. So if you did not win, do not worry. when we send out the replay email, which will be on Monday, Paxton is going to have another question for another prize. And you guys all did great. I know it was super fast. You have to have like fast typing skills for these, but you guys did a great job. All right, back to my questions. I forgot what I was talking about. Oh, estriol versus estradiol. So estriol is great if you just want to use it for vaginal dryness. It's not going to help with urinary tract infections or those types of things that require estrogen, but it can help with moisture. That's an option. But for all the benefits of estrogen, it's estradiol that is the potent estrogen that does all the things. Yeah, that's what you definitely want to have estradiol in your hormones. It can have a combination of estradiol and estriol. Estriol is just like the helper estrogen. It's not the potent worker estrogen, if that makes sense. Awesome. Cool. All right. And I just seen some questions come in just about, hey, I'm already on hormones. Can I work with you? And the answer is always, of course, like we'd love to work with you. But I just want you to know if you are already feeling good on your hormones, keep doing that. If you're not feeling good on your hormones, or your doctor's just giving you a standard dose that it gives to everybody, or you're not on hormones that you feel are safe for you, or you're on oral hormones and you'd rather not be, then we definitely can help you. How it would work is you would just continue taking your hormones. You can join the Healthy Hormone Club. We'll analyze your symptoms, test you on your current dose, and then we will transfer you over. And so we'll take great care of you. I just want to let you know, you don't have to work in, you don't have to join the Healthy Hormone Club in order for us to love you at Glow Natural Wellness. So we're to support all women getting health any way they can get health. Awesome. Yes, you can email Tammy. You can email our support at Glow Natural Wellness, or you can respond to any of the emails that we send, and we will see your question for sure. Awesome. Okay, we got a little bit of a long question here. Trying to get to the root cause of PCOS, postmenopausal diagnosis. What role, if any, do B vitamins play in impacting hormones? So B vitamins do play a role in hormone, like how they break down in, if you're deficient in B vitamins and you're still in reproductive years, you may have trouble ovulating. Let's see. Yeah, there's some impact on converting testosterone to estrogen that could potentially be a reason for PCOS, but most commonly, postmenopausal PCOS is because your estrogen and your progesterone rapidly decline, and your estrogen or your testosterone can stay pretty stagnant. It could stay high. And so a lot of times women will have all their life maybe higher than average levels of testosterone, but they also have pretty good levels of estrogen and progesterone, balancing them out. Then when your estrogen and progesterone dive down, your testosterone still appear, and that's when you start getting those PCOS type symptoms. So rather than it being a B2 or B12 deficiency, I think it's more due to the hormones dropping, especially if you're getting a diagnosis postmenopausally. You can definitely supplement with B vitamins and see if that helps. But I would just see if there's only so much testosterone that's going to convert over to estrogen anyway. You're not going to be able to convert all your testosterone over to estrogen. That's just not how it works. It's not a negative thing to ensure that all your vitamins and minerals are in line, making sure that even like your iron and your zinc and your selenium are in line and optimal, and all your vitamins are optimal. That's great. But I don't think that is the main driving cause of the PCOS. And then what you can do to remedy it, easiest thing to remedy it is going to be looking at inflammation. A lot of times PCOS is accompanied by insulin resistance, not all the time. Dealing with that, and then also balancing out your estrogen and progesterone, we can really just solve the problem right there. But just so you know, PCOS isn't always negative, because women with PCOS oftentimes can put on muscle better. They are more athletic. And so there are some positives to PCOS. And actually, if you look back in our ancestry, women with PCOS actually able to like survive famines and survive tragic times because they were able to run faster, fend for themselves more because of their muscles and their that extra testosterone. So it's not necessarily a horrible thing if you can balance it out. So hopefully that makes sense. But if you want to just check your vitamin status, you can definitely do a intracellular micronutrient test that will actually check to see vitamins inside and outside of the cells. And so if you just suspect a vitamin deficiency, that can be definitely something to look at. Let's see, I started Goddess Glow. I think you mean Goddess Drops 2 weeks ago. I noticed my bowel movement is now irregular. Could the drops be causing this? My poop has white spots from time to time. I'm trying to find out. Okay, Goddess Drops does help with your metabolism, which is definitely part of your digestion. When your metabolism's slow, everything moves slow, and that can mean your digestion's moving slower too. So it does help to optimize metabolism. So that could help with regularity. As far as spots in your poop or seeing different specks and colors, that's usually has to do with something that you ate or extra fats in that you're excreting. That's usually what that is. It doesn't have to do with the Goddess Drops. So hopefully that's helpful. Let's see. What did you say is best for hormones? What would you say is the best test for hormones? A 24-hour, Dutch, other. It depends on why you're testing your hormones. So if you are, maybe you're like 24 and you're having menstrual cycle issues, then I would generally recommend like a Dutch test because that's going to look at your natural hormone production and how your hormones are breaking down. If you are a postmenopausal woman, trying to see if you need hormone replacement therapy or wondering if you need hormones and you're going to your doctor, you can just have them add that to your blood test. If you are taking hormones and you're taking some topical hormones, transdermal hormones, in addition to oral hormones or just transdermal hormones alone, then you want to do saliva or blood spot hormones so you can test how those hormones are absorbing and doing in your body. So it's different situations for different tests, and then also finances. So even if you're 24 years old and you're having hormone issues, the Dutch test is pretty expensive. If you just want an economical way to see where your hormone levels are at, you can do a blood test or a saliva test. Any of those tests would work. So do you offer testosterone replacement for women? We do help to modulate testosterone with topical DHEA. So DHEA is the precursor to testosterone. So we use topical. We actually are just coming out with a sublingual DHEA as well that will bring women's testosterone levels up to the top of the range that is healthy for women. We don't use testosterone because it's not FDA approved in the United States. And being that we are telemedicine, we cannot do testosterone straight, but we are able to get testosterone levels increased to above the range if we wanted to using topical DHEA. It converts at about 50% to testosterone. How do you test hormones? We use dry blood spot and saliva testing to test hormones in the Healthy Hormone Club. And then outside of the Healthy Hormone Club, we use the Dutch test, we use blood testing, all different types of testing. Let's see. Carol, please will you send a link to published research you mentioned in your last masterclass so I can pass this on. So I think you're asking for a list of studies that we used to reference in the masterclass. So you can definitely email support and they will send those to you. If you're talking about the more recent specific study on hormones over the age of 65, I'm going to send that with this replay. Awesome. Yes, you're so welcome. Yes, I've never had night sweats or hot flashes, but experienced other symptoms, mood swings. Yes. Oh, I had to retire early from work. That is so common. Like I have seen, there's actually was a big news coverage last year about how so many women are feeling like they have to retire from the workplace because they're getting brain fog, they're getting severe fatigue, they're having horrible hot flashes at work, and they're not able to keep up because there's no accommodations being made in the workplace for women. And it's unfortunate because usually around 48 to 55, that's when you're at the height of your career, when you've worked your way up the corporate ladder. And it's unfortunate that workplaces are not making accommodations for women to deal with menopause, or at least making hormone replacement education available to them so that they can get the help that they need so that they can stay on top of their game and do their job. So I'm sorry that happened to you, but I'm glad that you're here and getting help now, because that is absolutely amazing. Awesome. Oh my God, these questions are going by so fast. I'm like in the middle of answering them and they're disappearing. So, hey, are your hormones in the Healthy Hormone Club different from the estr? Yes, I think I already answered this one. So it's yes, it's different from the estr. We do not use that in the Healthy Hormone Club. But any additional benefits from joining the Healthy Hormone Club? If you want the support, so you get unlimited access to our hormone specialist. We have a 800 number hormone hotline that you can call in anytime you need any help. We have resources for nutrition, for exercise, for pelvic floor therapy, for stress reduction, so many different breath work, so many different resources. And then we also get together every month. I have a happy hour. You get discounts in the rest of our products and services. And so it is a great program. It's more kind of community and then just hormone replacement. So there are definitely some benefits if you just want the extra support. I know a lot of times women come to me and they're like, I don't even get to talk to my doctor. And I don't really know that he's even cares what my symptoms are. He's just throwing prescriptions at me. So if that's your situation, then yes, join us in the Healthy Hormone Club. We'd love to have you. Let's see. I have hyperplasia. Would in uterine progesterone work better for me? My walls increase thickness on oral. So there are some women that intrauterine progesterone, like an IUD, is a good choice for progesterone, just because sometimes it's hard to control with oral progesterone. Topical progesterone, sublingual progesterone can be better, because when you take oral progesterone, you lose like 50% of it just through the digestion process, going through your digestive process, going through the liver, getting metabolized. So you're actually not getting that much of that progesterone delivered to you. So there's a couple different options. So sometimes they'll double your dose of oral. Some women can have some side effects with that, but sometimes it works fine. The IUD is fine because it stays local to the uterine. And some women feel like that's just easier, and it's totally fine. And you can have that IUD and then also be on topical estrogen and DHEA, and you can still be balancing your hormones that way. It's definitely an option for some women. I have seen some women who they just don't respond as well to different types of progesterone, and that definitely can help. How late is too late for hormones? It is never too late for hormones. I'm turning 68 this month, dealing with hair thinning, sleep issues, muscle and joint pain, concerned about cardiac health. I asked my provider a few years ago, and she said the doctor would be crazy to prescribing hormones at this age. Again, another doctor referring to oral horse estrogen, researched back 23 years ago, and then that study was debunked, but they missed that memo because they only saw the headlines. So for you definitely want to pay attention to the study that I'm going to send with the replay, because there was a recent study. It was done on women over the age of 65, and it found that the use of hormone replacement therapy actually helped reduce the risk of 7 different types of cancers, heart disease, Alzheimer's, and all-cause mortality, dying for any reason. Definitely bring that to your doctor if you want to have your doctor help you with your hormones, or go to a doctor that actually knows about hormones and is educated and up to date. Because sometimes even I've seen women to the Q&As, get information, go back to their doctor, and then their doctor begrudgingly gives them hormones, but then their doctor tells them they're on bioidentical hormones, and then we look at their prescription and they're on synthetic hormones, on equine estrogen, CEE, conjugated equine estrogen. And it's because the doctor doesn't really know the difference between the different hormones, unfortunately. Or sometimes in doctor's offices, they're just so busy. And if that's like the first thing that comes up when they're just typing in the codes, and then it just says estrogen, and they're like, okay, that's good. And they don't really look and see it's conjugated equine estrogen, and they don't really know the difference a lot of times. Nor do they like really, it's just that's what's available. Maybe that's the pharmaceutical rep that came to the office most recently. And that's just the unfortunate truth about like how conventional medicine works. And sometimes they're just too busy to really bother, but definitely going to someone that really is in on the front lines, working with menopausal women, prescribing hormones all the time. And then that person can give you a little more care. All right, let's see. What is the difference between globulin with estrogen and globulin with DHEA, which is recommended, or can you use both? So I actually recommend using both if possible. If you can only choose one, then figure out what your main concern is. So if you're getting recurrent UTIs from lack of estrogen, you're going to want to use the one with estrogen. If you are it's just vaginal dryness in general, I would probably go with the estrogen. Estrogen is going to work a little bit better because with the DHEA version, we are depending on the DHEA to convert to estrogen to have the effect. But the other benefit of DHEA is it helps with arousal, sexual stimulation. So if that's a problem, libido is a problem, like getting in the mood, then the DHEA version is great. I really like the benefits of both. So using the estrogen version in the morning, the DHEA at night. The bottles do last about 3 months. And so if you get both of them, that's going to last 6 months. And it's not a big investment when you look at how long they last. Awesome. Hopefully that makes sense. If you go to our Glow Below page on our website, we're going to give you a lot more information there, and you can really read about the different versions. Awesome. Thank you. Let's see. I'm 62. I always feel cold. Is this hormone balance? Should I be taking a hormone test? Should I be taking hormone replacement therapy? I'm in the menopause stage right now. So you're probably like, everyone's talking about hot flashes and I'm cold all the time. So could be related to estrogen because it's a temperature regulation issue, right? So it could have estrogen, but I'm actually feeling that it might be thyroid as well. So I would definitely recommend having your thyroid tested and getting a full thyroid panel. So when I say a full thyroid panel, not just TSH and T4, that is usually what doctors will test. They'll test thyroid stimulating hormone and T4, which is the inactive version of your thyroid hormone. It's the one that your thyroid outputs the most of, but it has to be converted into T3. So a full panel is going to be TSH, free T4, free T3, reverse T3, and then your thyroid antibodies. So when you hit like menopause age around 40, 45, 50, that's also a lot of times when thyroid starts going downhill, and there is a connection. Estrogen helps support your thyroid. Progesterone helps to support thyroid hormone production. So when you lose estrogen and progesterone, it can put a tax on your thyroid. I would definitely recommend testing your hormones. I would also test your thyroid. So when I say test your hormones, thyroid's a hormone too. But when I say test hormones, I'm usually talking about menopause hormones. So I'm talking estrogen, progesterone, testosterone for hormones, and then thyroid would be a thyroid panel. So if you have a doctor that is forward thinking, you can ask your doctor to test those hormones for you. If you don't, or you hate asking your doctor to do stuff for you, or he never does, you can also order that off of our website as well, and we can run it for you. We have 2 options for thyroid. So we can send you to a blood draw at a place near your home. So that is going to send you to a local lab. You're going to get a requisition order. You're going to go to the lab. They're going to draw your blood. The lab's going to send us the results, and then we're going to send those to you. Or if you don't want to travel to a lab, we can also use blood spot testing. So a little finger prick, pop it on the card, and we can also get your thyroid levels from that. Both are accurate. Both will give you the same results. It's just a question of what you want to do. So that's one way. And then you can also do your hormone testing as well. Now, do you need hormone replacement therapy? So not everybody needs to do everything. I'm in the opinion if like living a long time is your goal, if being as vibrant and active and aware and youthful as possible, if that's your goal, then I think all women who want to live 80, 90, 100 should be using hormone replacement, because otherwise things are going to start declining, deteriorating. So yes, I would say hormone replacement would be wonderful for you. However, do you need it? You don't need hormones to live. You just need them to live vibrantly past your years. Because remember, and maybe not remember, maybe you didn't know this, but it wasn't that long ago that the average life expectancy for women was like 58 years old. So That's not that long ago. It's like in the 1930s, 40s, maybe 20s, that women only lived till 58, 60, 62 is like you were old. But now women are living average age 88, but that's average. So half the women are living longer than that. And I think it's keeps going to keep pushing as like we have advances in technology, as things are become easier and easier. We're going to live to definitely 100, maybe 120. And so do you really want to live half your life, more than half your life, in a hormone deficient state where everything's a little bit harder, where your bones are a little weaker, where you can't build muscle, where your collagen's going away, hair is falling out, your brain's not working as well. And so those are all the reasons why you want to use hormone replacement. All right, I know that there's things in the chat. I'm not really looking in the chat right now. I'm going through the Q&A questions because there's a lot of them. And I want to try to get as many answered as I can. I'm just going to take a little sip of my drink.
The questions in the chat are being popped over into the Q&As.
Oh, you're the best. Awesome. Thank you. Yeah, so I'm just like, ooh, I see it scrolling and it makes me nervous. Awesome. Does the Healthy Hormone Club include estrogen, progesterone, testosterone? So we test estrogen, progesterone, and testosterone in the Healthy Hormone Club. And then the hormones we use to help bring those hormones back in balance are estrogen, estradiol with estriol included, or just straight estradiol, progesterone, and DHEA, which is the precursor to testosterone. So yes, we fix all those hormones. Let's see. What do you think of the Estring and Doty? I am taking both. I feel good. And I'm 77 years old. Doty. I have to look that one up. There's like real names for it, and then there's like slang names for it. So it's a patch. So let me see. That one looks like it's okay. I'm just looking at the label. Yeah, so that is transdermal estradiol. So that is bioidentical. And the E-string is also E-string. Ooh, let me see. There's so many now that I have to actually. I think the E-string was one that there were some problems with, if I'm not mistaken. So let's see. That one's also bioidentical, but did have some recalls because it did have some irritation caused, and some people had had it removed. So if you're doing okay on it, that's okay. It does sometimes cause irregular bleeding, and it also can increase the risk of uterine cancer. But other than that, it seems like it's bioidentical, but the other stuff that's attached to it can sometimes cause irritation. But if you're doing good, then you're fine on that. Do I need HRT if I don't have any symptoms? My sister encourages HRT so I don't get a stroke like my mom, but the Vagifem warnings said the opposite. Okay, so don't use Vagifem. Let me see what the Vagifem warning is. Let me look. I don't even know why Vagifem would have a bad warning because it's super low dose vaginal estrogen. I'm trying to read the warning for you. Yeah, it does. The warning does say if you have liver problems, but it's not metabolized by the liver, if you've had blood clots, but vaginal estrogen wouldn't have an effect on that. So it might just be like a standard warning for all hormones, even like bioidentical versus synthetic, but it seems to be fine. I'm just not sure what other ingredients are in there, so I'd have to dig in. I don't personally use this particular product in my practice. It contains estradiol, but it might also contain other things. That's why I would just look at what the full ingredients are. Let's see. It seems like many doctors are regarding bioidentical hormones as a panacea with little to no risks. May I ask what are the real risks? All right, so the reason why most doctors are saying bioidentical hormones don't have real risks is because it's the same biological hormones that your body has had all your life. It's just like vitamin C or vitamin D. Like there's sure if you overdose, if you just bathe in bioidentical estrogen cream, there's going to be some side effects. if you don't follow directions and you're just using 10 times the dose you're recommended. There can be side effects, but there's really no long-term negative side effects of properly dosed and delivered bioidentical hormones for women, because it's a substance that the body is used to having. It's a substance that the actually body needs. And but the danger is actually not replacing your hormones. That is what puts you at risk, not replacing your hormones. The problem is when you replace it with things that are not quite hormones or that have other like fake hormone ingredients, or it's like a hormone. If you have kids and you're like, I really need them to eat more fruits and vegetables because I want them to have all their vitamins and minerals. So you go to the store and you're going to buy oranges. And you go to the produce department, they have oranges, but then they also have orange Skittles next to it. And you're like, should I buy the oranges or the orange Skittles? They're both orange and they both have the orange flavor, but they're not the same. Like the orange Skittles are going to cause diabetes and tooth decay, and they're not going to give you any benefits, but the oranges are going to give you benefits. Now, if you ate 1,000 oranges, you might feel sick. And so same thing with hormones, like bioidentical hormones, when dosed and delivered appropriately for each person, do not really have any side effects. It's what your body is craving. It's what your body needs. Just if you are low on insulin and your body's not producing any, you're going to put insulin back. If you're low on thyroid hormone and your body is not producing any, you're going to want to put thyroid hormone back in your body. And the side effects of not having that thyroid hormone are going to be much less than having the thyroid hormone. But if you give yourself too much, if you don't read the prescription and it says take 1 pill and you take 30 pills, then you're going to cause some problems. It's all in the dose and the delivery method, but bioidentical hormones are absolutely safe. Now, there's some like non-long-term, some just like annoying like side effects when you start. Could be a little bit of water weight gain. You could have, some women might notice some bleeding, some vaginal bleeding for the first month, like not all months, but like you might get some bleeding here and there because you're starting up some hormones. Some women might notice some breast tenderness or fullness in their breasts because now you're having hormones again that you haven't had in a while. So, but all those things go away with continued use, usually within the first 4 to 6 weeks. But as far as like dangers, safety, the danger is in not having hormones. That's where the danger is. That's where all of your risks of all different types of cancer, heart disease, Alzheimer's, dementia, rapid aging, bone loss. The list goes on and on, high cholesterol, diabetes. All those risks increase when we are without our hormones. We were designed to not live past our reproductive years, but now we are living past our reproductive years. So we want to have that second half of our life feeling amazing, right? Why not? Awesome. All right. So hopefully that makes sense. You can tell I'm super passionate about this. Let's see. Who is regular HRT? Oh, how is regular HRT and BHRT a little bit contraindicated? Oh, who is it contraindicated for? Really, I would say the only person I would say should not be using hormone replacement therapy is someone who is actively trying to suppress hormones. So if you're actively getting treatment for cancer and your treatment is to take a medication to suppress hormones, then you don't want to be taking hormones, right? And then I would say anyone who has adequate levels of hormones shouldn't be adding more hormones on, because that can cause some problems. We see a lot of times with women who go get pellets, they go get a super duper high dose of hormones and then their hair starts falling out, they start gaining weight, they get really irritable, voice changes, all types of things happen because they're on super high doses and they didn't even need the hormones. There's not really many other contraindications if you're using properly dosed, properly delivered hormones. That means the right delivery method. So that means sometimes avoiding oral hormones. That means sometimes using vaginal hormones. That means working with someone who can help you get the right delivery method. And topical transdermal hormones are the safest. They bypass the liver. So a lot of those liver enzymes and the negative things that are byproducts of metabolism, risk of stroke, risk of heart disease, things like that, those are going to be bypassed with the topical transdermal routes. Let's see, I'm 60 plus. Is it too late to start BHRT? Absolutely not. Yes, the most recent studies say that it's absolutely helpful, reduces risk of cancer, dementia, diabetes. So I will share that most recent study with you when I send this replay. I feel like I should find it for you guys because I feel like everyone's asking for it. Jen, can you find that email?
It's so good. I saved it. Do you want the whole email or you want the study that's linked to it?
Go ahead and just pop this study in the chat for everybody, since everybody's asking for it. And it's a theme. We've got a lot of women over 60 who doctors are saying is dangerous to start their hormones.
All right. Let me see if I can find it. I know I saved it. Yeah, I'll look.
Yeah, it's at the bottom of that email.
That's what I thought. Okay, cool.
I literally, you guys, it's so funny because I am the queen of having so many tabs open on my computer. And before this Zoom, I'm like, I don't want my computer to slow down the Zoom call. So I closed all my tabs and I literally closed that study like not even too long ago. But yeah, so Jen's going to find it for you and pop it in the chat. It was like Kathy might have it. I don't know if you can paste it in the chat. Oh, wait, hold on. Let me see. Okay, everyone. So, can you guys not see each other's chats? Is that a setting that I have to fix?
They can only send it to us. They're not seeing each other in the chat.
So Kathy, if you want to, oh, it won't let you copy and paste either. She's saying she's trying to paste something in the chat, but it won't let her. So I'll let Jen handle it. I don't know if you can chat just Jen, perhaps. But thank you though, Kathy. I really appreciate it. All right, let's see. Is there a listing to find a local doctor for bioidentical? 69. I still get hot flashes. If you want to find a local doctor, I really recommend trying to get a referral just because it's always nice to have someone who another woman has said, yeah, they're really good. They really care. They're going to give you individualized care. They're going to look at your symptoms, like things like that. They're not just going to belittle you. But so that's one, or you can just look up doctors, interview them, ask them like how many of their patients are on hormone replacement. If they're like, oh, I don't really believe in hormone replacement therapy, then you're going to go the next one. So I would just see, that's probably the best way, just to interview local doctors and see. But if you can't find one, we can definitely help you in the Healthy Hormone Club. We are available all across the United States and also internationally. So we can totally help you. And we ship the hormones to your door. We ship the testing to your door. You meet with your hormone specialist via phone call or Zoom. It's HIPAA compliant, so it's all encrypted, so your information is safe. You get access to the online portal. We meet monthly in not this webinar format, but where we can see each other and talk to each other in Healthy Hormone Club happy hour. So it's really a great community. And so if you can't find someone local, we can totally help you. And you actually get more interaction with our team than you would with a local doctor, because you're going to call the doctor's office and you're going to talk to the receptionist, and you're not going to really be able to really talk to anybody. You're going to have to wait until your appointment. Okay, Jen did post the study or the recap of the study there in the chat. Awesome. All right, let's see. My fingernails are always thin. I have vertical ridges and spoon. I had total hysterectomy 20 years ago. I didn't start BHRT until 1 year ago. I'm 67 now. Can my past hormone decline be contributing to my nail condition? It could. If that's the case, then they will start to get thicker as you continue on your hormones. Like your bones, your nails can take a little bit of time, but it could also be protein deficiency or a nutrient deficiency. A lot of times our nails can be mirror to some deficiencies in our diet or our digestion. Sometimes like when you have the spooning, where it dips in, that's like an iron deficiency a lot of times. Looking into whether that can possibly be iron deficiency. With iron, if you're vegetarian, it's really hard to get iron because the iron from like animal proteins is more easily absorbable. And then if you have animal protein, you want to also have vitamin C, like broccoli with it, because that helps you absorb. But you can also do an iron supplement. Sometimes those can be a little bit harsh on your digestive system, can cause constipation. So just maybe be a little careful with that. But if you can just have like more iron rich foods in your diet, that can be helpful as well. So that's usually the spooning of the fingers usually causes that. Now the brittleness, dryness, that can definitely be estrogen. Awesome. So hopefully that's helpful. You definitely, if you aren't, it looks like you are in the Healthy Hormone Club. So feel free to reach out and ask a question. And if one of our hormone specialists doesn't have that answer, we actually have a functional medicine health coaches on our team that can help you and either give you a list of iron-rich foods that you can eat or give you some troubleshooting on your fingernail issues. So definitely, we would love to help you. Awesome. And thanks for coming on the call too. Let's see. I started 6 months ago. My estrogen is 1.25 per day. Okay, let's see. This is anonymous. So I'm not sure if you're answering another question, but just so you know, if you're in the Healthy Hormone Club and you start on one dose, that does not mean that's the dose that you're going to stay on. So if you are feeling like you still have some symptoms or you are feeling like you want some more hormones or you're not really sure, definitely follow up, book a call into the 800 number and say, hey, can we look into a dose adjustment or here's the symptoms I'm still feeling. And we may adjust your dose because everyone's a little bit different. So we're going to start you where we think you should be, but everyone's a little different and we oftentimes will need to adjust things. So if you think you need a little bit more, even a little bit less, sometimes we'll definitely work with you on that. Do you prescribe just estrogen and progesterone, also DHEA, testosterone, and HRC? So estrogen, progesterone, DHEA. We don't have testosterone because testosterone is not FDA approved for women and cannot be sent over a telemedicine platform. So that's why. But the DHEA does work beautifully for increasing testosterone levels. Let's see, is this and previous Q&As found in archive online somewhere or replays just sent to emails? Generally, most of the time, I will post the Q&A on my YouTube channel. Most of the time, you'll see any of the Q&As, live Q&As that I do, as long as I remember to and record it and everything. Am I recording? Oh, shoot, that just scared me. I'm like, I didn't know if I recorded, but I have it set to automatically record now. But usually, as long as I remember to record, I'll generally post it up on my YouTube channel and everyone can watch it then. Because a lot of times people will find me, or sometimes people just want to learn about hormones and they like listening to all your questions. I try not to identify anyone by first and last name with the questions so that it's pretty general. But that's why we don't let you guys raise your hand on these, because a lot of times I will be posting them or come on and talk because I will post them on YouTube. So I don't want your faces on here. But in the Healthy Hormone Club, we actually do go face to face. We do talk to each other. And those are the happy hours. And those are actually stored only in the private Healthy Hormone Club behind the portal. So yes. And yes, you can have access to the replays indefinitely. So like I said, most of the time they live on my YouTube channel, and then we will also send you a link in email. Generally, since it's Friday night and I'm probably gonna be on here pretty late with you guys, generally I will stop working after the Q&A, go relax with my family. And usually by Monday, end of day Monday is when I will get the replay out to you guys. If you're wanting to rewatch or you're wanting to relive this event, it will generally come out on Monday, and then I will likely post it on my YouTube channel, so then you can at least have access to it. And you can share it with friends. And I try to do these at least once a month, but I'm probably going to start doing them every other week and maybe keep them to an hour so that everyone doesn't have to stay up with me all night. But I actually really love answering questions about hormones. And I might try to do topic based, all hormones about osteoporosis, all questions about that, and maybe all questions about heart disease, so that you guys have a little more, you can watch certain ones, and then we'll do open ones like this, because I think it's really important for you to have a voice and to get questions answered. Awesome. Do bioidentical hormones affect cholesterol at all? So yes, we did just talk about this probably about 20 minutes ago, but yeah, so when estrogen declines, inflammation increases, cholesterol increases. When you use bioidentical hormones, inflammation settles, cholesterol settles. It does take a little bit of time though, and there's also lifestyle involved. So if you have high cholesterol and you have a healthy lifestyle and your estrogen, it's because your estrogen declined, then using bioidentical estrogen will usually help that situation. However, if you are just eating donuts and bacon and a lot of just like sugar, and you're living an inflammatory lifestyle and you're going out and drinking every weekend and you're surrounded by toxins and your cholesterol's high, taking estrogen probably is not going to be your golden ticket. You're probably also going to have to do the lifestyle stuff. But I do know a lot of women who are super healthy. They walk every day, they eat a healthy diet, and their cholesterol increases because of the estrogen declining and a little bit of genetics. In those cases, estrogen does generally help along with the lifestyle changes. Awesome. All right. What countries have women and men been using hormone replacement for the longest period of time? What can be gleaned from these long histories of use? Okay. So the earliest I know of hormone replacement is, I think it's like the early 1900s in China. So what they used to do is they would take young girls and they would have them urinate on these cloths, and then they would let the cloths dry until the urine crystallized and turned to a powder. And they would scrape this powder off and they would put it in capsules or in little like packed little compact powder tablets and give it to the wealthy older women. And that was the first hormone replacement. But more popular hormone replacement, like more traditional, really didn't start until the 40s, 50s, because women didn't really live past menopause. That's where that started happening. I would say Europe and the United States are probably the most prevalent countries that are known for hormone replacement. I'd say Europe is probably ahead of us because in the European unions, most of them are now including hormones and hormone education much more prevalently than we are here. I think the UK is a little further ahead. All right. Can topical bioidentical hormones stop hair loss in women over 60? Yes, we've seen it over and over again. Progesterone is a huge one for helping with hair loss. And also with hair loss, a lot of times it does have to do with the imbalance of androgens, DHEA, and testosterone to estrogen and progesterone. When you lose your estrogen and progesterone and you have still regular amounts of testosterone, what happens is your follicles, your little hair follicles will actually shrink. It's called miniaturization. And when you don't have that progesterone and the estrogen to help the health of the hair follicle, then you'll lose more hair. And then you might have noticed if you've ever been pregnant, how nice and beautiful and lush your hair is when you were pregnant. That is the estrogen and progesterone helping your hair be more silky and more manageable and fuller and thicker. And so, yeah, your hormones can definitely help, but I would also look at thyroid. That's another issue. And then there is some genetics. So some people genetically are programmed for their follicles to give up at a certain age. And for some people, there's not. There is no hormones that will change that. But even now, there's a lot of research about topical progesterone on the scalp and then red light therapy. So we are actually formulating right now a hair repair serum that has some herbs and some actives and some progesterone in it, low dose, just for the follicles on your head. But hormone replacement therapy in general will help you with just like keeping your hair healthy. And your skin too. We lose a lot of collagen as we age between the ages of 50 and 54, generally like the first few years of menopause, you lose 33% of your collagen. So this is like your structure of your skin. And by using hormone replacement therapy, if you catch it before that, you won't lose that 30%. But even if you catch it after that, you can rebuild that collagen so that you can have your own like facial structure and stay more youthful and have your skin have more moisture in it and have your skin microbiome stay healthy. Because that's why a lot of times, if you've noticed, as you get older, your skin becomes more sensitive, like you have more rashes and you break out more just from like different sensitivities, more rosacea, more things like that. And then estrogen does help with that as well. So I know I talked about skin and hair, but they're related in the reasons why we see the decline. Okay, can you comment on various plant-based oils in and around the vagina? What do various plant-based oils do to overall microbiome diversity, overall function below the skin surface? That's an interesting question. As long as the formula that you're using is pH balanced and for use in the vaginal area, it won't really affect the microbiome. Estrogen itself is really important for the growth of certain microbes like lactobacillus, which is super important for the health of your vaginal tissue and for reducing or protecting you from urinary tract infections. Having estrogen in your vaginal area and your urinary tract can be super important for making sure that the microbiome balance stays fresh. I'm not really sure what you mean by various plant-based oils. It's more about the pH balance of the formula than it is the oils. There's like safe oils for use, like coconut oil is safe, olive oil is safe. You can use, a lot of people use as lubricant, and there's nothing wrong with that. It's not going to mess up your microbe balance. So I'm not really sure if that answered your question or not. Biggest perimenopause and menopause symptoms, biggest problems perimenopause and menopause symptom people run into. Symptoms, chronic conditions that bioidentical hormone replacement addresses across women of all demographics. This sounds like a research paper, but I would say the biggest problems, the most crucial problems are heart disease, dementia, osteoporosis, right? Because those are the killers. And so bioidentical hormones protect from those, and also 7 different types of cancer, colorectal cancer, uterine cancer, breast cancer. So those are big ones. But then the most common is going to be insomnia, hot flashes, low libido, rapid aging, itchy skin. I actually have a resource that you might like. It seems, I don't know who's asking this question, but it's anonymous, but I can tell you're a researcher. We have a great resource on our website. If you go to our website, fixhormones.com, and you go to the free resources, there is a guide, 99 symptoms, 1 root cause. It goes through all the different symptoms of hormone decline and which hormones associated with it. So I think you'd really love that. And so it's, I don't really like to pick a most important symptom, because whatever symptom you're struggling with, it generally is the most important one to you, right? I know a lot of people fear Alzheimer's, right? It's like the thought of losing our mind and having dementia and not being able to care for ourselves and having someone having to wipe our butt when we go to the bathroom. That's mortifying for most people, right? And so for a lot of people, that's the big one. It really depends on your individual, like you, your lifestyle, and what you're dealing with. So it's hard to say the biggest or the most impactful. I actually have an article about menopause and thyroid, but progesterone helps with the conversion of the inactive thyroid hormones to the active thyroid hormones, so T4 to T3. And then estrogen helps with the health of your thyroid tissue. So making sure it stays active and it's able to be producing thyroid hormones. So those are like the main reasons why menopause affects thyroid function. And but also other things as we get into, as we lose our estrogen and progesterone, we become less stress resilient, like we become more easily rattled. And then that stress can impact the thyroid function. So there's a lot of just downstream reasons why menopause, or a state of menopause in general, can impact thyroid function. But the main like direct impact of estrogen and progesterone on the thyroid is, as I just said. Okay, so I've been using topical bioidentical hormones for 7 years. Sounds like saliva tests would be okay as you explained it. Yes, exactly. Yeah, so saliva tests would be great on topical hormones. I would totally recommend saliva testing. If you're going to do saliva testing, I would recommend taking your hormones like between 8 to 12 hours before your test. So that way they're still flowing active in your system. Progesterone is a little bit tricky because some women are going to metabolize progesterone faster. It's designed so that if you take it at night, you're not going to be, it helps relax you and make you tired. And so it's designed to be out of your system by the morning so that you're not still sleepy when you wake up. If you're going to test progesterone, you want to do it between 8 to 12 hours after your last dose to get a more accurate reading. Awesome. Yeah, so you don't want to not use your hormones the day before your test, because if you're on hormones, let's say you're on hormones regularly, you've been taking hormones, looks like this person said, for 7 years. So you want to continue taking your hormones and then test in that 8 to 12 hour window so that you can see what your levels are on the hormones. Now, if you haven't been using hormones, you can test. If you are cycling, you want to test between days 19 to 21 of your cycle. That's when your estrogen, progesterone should be peaked. And if you're not cycling anymore, if you're in post-menopause or you're not on hormones, you can test any day and you don't have to worry because you're not using hormones. So you test just in the morning. And in the morning, when you wake up, is going to be when testosterone is going to be highest. So I like testing in the morning. Hopefully that's helpful. But yeah, saliva testing if you're on topical hormones would be great. You can also do dry blood spot testing. Some people have issues with producing saliva. There's some health conditions where it's hard for people to produce saliva. So in that case, there's a dry blood test or capillary blood test where you prick your finger and you put the little blood on the little card. And that is also a great way to test topical hormones.
So this is, if I haven't had HRT and I'm 60, 10 plus years since perimenopause, how long before I notice benefits?
So it depends what symptoms you're experiencing. So if you're experiencing like a lot of like day-to-day symptoms, trouble sleeping, hot flashes, low libido, you're probably going to notice some benefits fairly soon. Some people, it's like day one, they're like, it's the best sleep I ever had the first day. And then other people, it takes them a little while. Sometimes it's just about getting the dose. Sometimes if it's been a while since you had hormones, we might start you on a lower dose just to help ease you in. And so then it might take just a little bit longer for you to get symptom relief. But you'll notice some symptoms pop off faster, other symptoms take longer. So you might notice like you're sleeping better, but you're still having a few hot flashes or you're still irritable. And then it takes a week for that to happen. So it's very individual. It's really hard to say. It surprises me every time. Like people are like, oh, this symptom went away and I'm still working on this symptom. But a lot of times, like it's within 6 weeks, you're going to see a big improvement. And then at 3 months, you're going to see even more improvement. And generally, then you'll just keep maintaining. But the more you actually also incorporate some mindfulness, incorporate some nutrition strategies, incorporate some exercise, like differently maybe than how you were doing before, maybe some strength training, that is all going to also help. And then just being part of the community helps too. I really think that being a part of like-minded individuals that are all working towards a similar goal in a positive environment just helps as well.
Beautiful. This one, next question. My husband doesn't want me to use estrogen, progesterone, DHEA, and other creams because he's afraid I'll somehow rub them off on him during sex and with regular touch. But from what I understand, creams are more effective. True or no? What can I do here?
Okay, it's a few different things. One, when you use hormone creams and you rub them in, if you rub them in thoroughly, the hormone is going to absorb into your skin and is not going to be transferable after like the first minute. So just make sure you're rubbing them in thoroughly, just not right before sex. But you can use your DHEA right before sex because that is androgen. So that's a male hormone, right? So it's not going to hurt him. It's actually going to benefit him and might even help his testosterone levels. And then men also do have progesterone. Men have estrogen as well. Because men, like even if men have migraines, they'll give them progesterone to help with migraines or traumatic brain injuries. We've seen a lot of times car accidents, traumatic brain injury, progesterone is actually given to both men and females to help the brain repair. But as long as you rub the creams in thoroughly, so you pump it on your arm or on your leg, you rub it in for 30 to 60 seconds, and then it's fully absorbed. You're not going to be able to transfer it to him. Just make sure you wash your hands if you're using your hands to rub it in. And even if you want to be double sure, you can put your hormones on in the morning, your estrogen, progesterone, wait a couple hours, you can take a shower and the hormones are already absorbed into your skin, but you'll be fine.
Beautiful.
But
Are there any restrictions or no's to be HRT? I heard certain autoimmune diseases were out of the question for HRT.
some people with lupus, they need to have lower levels of sometimes progesterone, but it depends because if you have an autoimmune condition, so let's say you're of reproductive years and you have an autoimmune condition, they don't suppress your hormones to help you with the autoimmune condition. It's the synthetic hormones that are generally a problem with certain autoimmune conditions, but something like Hashimoto's thyroiditis, actually hormones are going to help that because most autoimmune conditions, Hashimoto's, lupus, MS, they have an inflammatory component to it. And so when hormones are low, specifically estrogen, when it's deficient, you're going to have more inflammation and that's going to fuel more autoimmunity. So having hormones balanced is going to be your best bet for autoimmune conditions, pretty much all of them.
Are bioidentical creams for life? Any concerns to watch out for being on them long term?
Yeah, no, not a concern at all. And the concern is being off of them. So yes, you can. So do you have to be on them for life? No, you only have to be on them as long as you want to be on them. However, like I will be on them for life. Oprah Winfrey is quoted on saying, "Don't ever take my hormones away. I'm going to be on them until I die," because when you're replacing your hormones on a daily basis, and then if you stop replacing your hormones, then you go back to that hormone deficient state and you go back to at risk for all those diseases again. Now, you do have some cumulative effects. So let's say you've been on hormones for 10 years, that's 10 years of not having that inflammation. So you're going to be better off at age 80 than someone who had never been on hormones, but you're still going to start that decline once you're not on your hormones anymore. Yeah, as long as you want to stay living a healthy life, it's just, do you have to brush your teeth forever? You should if you want your teeth to stay healthy, but you can stop brushing them and eventually your teeth might fall out. So it's just like that kind of like, you don't have to do anything, right? Like I hate saying that like you have to do it, but is it smart? Yes, especially if you're on bioidentical transdermal hormones, then there's no tax on your liver either. So you can be on bioidentical oral hormones, but your liver has to do something with those. And that's always a consideration because it has to be metabolized through the liver. And then there's byproducts of that metabolism. So that's why topical bioidentical hormones are the safest because you bypass that metabolism, goes straight to the tissues, and there's no extra stuff. In the scientific term, extra stuff.
I need to mute myself because you make me giggle, and so I don't want to keep laughing. Okay. When you start the creams and have headaches, how long does it take for them to subside, or do you have to adjust your creams?
Are we saying that you started creams and it's giving you headaches, or are we saying if you have headaches and you're starting creams to help with the headaches? Do you know? Can you tell?
Not really.
Okay, so if you have headaches, like we were talking about progesterone, specifically people with migraines, sometimes they'll take progesterone to help with the migraine. Generally, it's probably going to be a situation where you're getting the dose. So when you first start using it, you may or may not be using the proper amount because you're going to use some and see what happens. And then next time you might increase your dose and see what happens. So yeah, I would say within 2 weeks, you should start seeing improvement. If you're getting headaches when you take hormones, then that could either be one, you're have an imbalance, you're not at the right balance, or two, possibly you have a sensitivity to either something in maybe the patch adhesive, maybe in the cream, maybe in the oral hormone, or whatever type of hormone you're taking. They should not cause headaches. And so if it's causing headaches, it's generally some type of allergy or sensitivity.
And if you're with us, you can always call in and talk to our hormone specialist and get dose adjusted.
And then just as a caveat with the headaches, it's also meaning it also has to be assuming that the headaches are caused by a hormone deficiency. So there's many other reasons for headaches. Number one reason, dehydration, food sensitivities, mold exposure. Headaches can be caused by a lot of things. So if you're taking hormones because you have headaches and it's not caused by the hormone deficiency, then the hormones won't help the headache, if that makes sense.
Mm-hmm. Okay, I have low-grade cervical cancer. Can I take BHRT?
You can. Hormone replacement therapy, specifically estrogen, is shown to be protective for cancer and cancer reoccurrence. And there's many studies for breast cancer and also cervical cancer showing that women who have been on hormone replacement therapy for any period of time have better outcomes than women who haven't. Also, women who have had more pregnancies, so they've had more time in their life with higher levels of hormones, are also more protected than women who have not had pregnancy. So it's any way that you're getting more hormones into your system is protective.
Okay. Is it safe to take estradiol, BHRT, as a topical, even if estrogen toxic, then in parentheses 4-hydroxy pathway, and diagnosed with grade 1 ER/PR positive cancer?
Okay, so it sounds like you have issue with detoxing your estrogen, or you're actually pushing your estrogen metabolites down the more pathogenic pathway, creating oxidative stress. And I would definitely be working on estrogen detox and lifestyle, but also you can do some supplementation, stuff like DIM and B vitamins can be super helpful. Sulforaphane, eating things like broccoli, cruciferous vegetables, all those help your estrogen metabolize down a healthier pathway. And so I would definitely work on that. You can still take estrogen if you're deficient in estrogen. So if you have super low estrogen, even if your estrogen metabolizes down a more unfavorable pathway, you don't have really any estrogen to metabolize. So you can still take healthy levels, physiological doses of estrogen and support estrogen metabolism at the same time. But I would just check with who's ever treating you. I never want to give medical advice in this format. I'm just telling you like what is possible. But definitely check with your doctor for his recommendation.
Okay,
Get a second opinion.
Oop. Okay, Dr. Michelle, I'm 45, but my period never came back since my son was born 3.5 years ago. Does that mean I have an earlier menopause? What does this say about my hormones?
Yeah, there's actually like a term that I coined, postpartum perimenopause. Women who have children later in life, it's a little harder for your hormones to bounce back after pregnancy. Generally, if let's say you're in your 20s, 30s, have a baby, if you're breastfeeding, your estrogen is going to stay low, your hormones are going to stay lower for a period of time. And it generally takes about a year to get your period back. Some people a little bit longer, some people a little quicker. But when you're like over 40, it can take a little bit longer. So you may or may not be in menopause. 3 years you might be. So a lot of times it's just your body is like almost there, perimenopause, and then you have this big hormone like avalanche. So hormones go up, then they go down with the pregnancy, and sometimes they don't come back after that. But you might surprise you. You might notice that you have your hormones come back in a year. Now, also it depends on how long you've been breastfeeding. Most people breastfeed a year and then they start on solid food. But I have a friend who breastfed till 5 years old. And then I know of other people that breastfeed even longer. And your hormones are not going to come back while you're breastfeeding. If you're still breastfeeding, that could be a reason why your period hasn't come back. I'm not really sure your situation. You can definitely do some testing to see your ovarian reserve and to see where your AMH is and things like that to see if you do have more eggs in the bank, so to speak. But it could be you're in that age. Average age of menopause is 52, but that means a lot of women go into menopause in their 40s. So, and even some in their 30s. So you could be right there.
Okay. Is there a way you can increase testosterone if you tend to lose hair when you supplement with it? Will DHEA do the same?
Okay, so DHEA is definitely one way that you can increase testosterone. However, if you're saying that when you lose hair, when you supplement with it, DHEA will also supplement your testosterone. So it will go up, maybe not to the extent, maybe if you were supplementing with too much testosterone, you might lose hair. So a lower dose may be helpful, but also testosterone is actually the one hormone that we can impact with lifestyle. So weight training, getting proper sleep, these things can actually help your testosterone go up, avoiding toxins. So having a healthy lifestyle, doing some heavy weight training, eating enough protein, and reducing stress will actually help your testosterone levels as well. You can do that, and DHEA supplementation, start low, slow. And then the other thing you can do is there's some herbs that can help push your testosterone metabolism down the less androgenic pathway. So there's two pathways. Testosterone has two pathways it breaks down. There's an A and a B. And so let's say the A pathway stands for androgens. That's the more androgenic pathway. So that's a pathway that's going to be facial hair, acne, hair loss, belly fat. Those are all like the negatives of either too much testosterone or testosterone going down the more androgenic pathway for women. And so what you can do is if most of your testosterone is going down that pathway, you can push it to the other pathway by the less androgenic pathway with using some herbs. Saw palmetto is one of them. So SAW palmetto, PALMETTO, Pygeum, PYGEM, nettles, NETTLS. So those three herbs together, or spearmint tea is another thing that also works. Those will help to push your testosterone down the not so androgenic pathway. So that way you can take some DHEA and you can use that herbal combination or drink spearmint tea 2 cups a day. And that will help push the pathway so you don't lose your hair, you don't get facial hair, acne. But make sure, I would also test your testosterone levels, because maybe you do have enough testosterone, and those symptoms that you think are low testosterone symptoms are actually low estrogen symptoms, because there's a lot of overlap there. Also, low thyroid has overlap with low testosterone. So it's important to know which hormone's really low.
Perfect. Okay. If I do glow natural topical bioidentical hormones, only estradiol and DHEA, however, do an oral bioidentical progesterone that my new doctor just agreed to prescribe, will that work?
Yeah,
do
absolutely. Yeah, you can do any combination as long as you're doing, if you have a uterus, you have to have a form of progesterone to protect from overgrowth, because estrogen makes things grow, progesterone makes things not grow. So like your uterine lining, if you're going to use estrogen, you need progesterone to counteract it. But if you don't have a uterus, then you can go without progesterone. However, progesterone does have a lot of benefits mentally, physically, our hair, our nails, our brain, sleep. So we like having progesterone on board, whether or not you have a uterus. A lot of doctors will say, oh, you shouldn't use progesterone if you don't have a uterus. And that's absolutely wrong thinking. That is treating women as if we're just reproductive machines, which we are not. There's more to us than our uterus. And progesterone is important. But yes, you can use IUD, you can use oral progesterone, you can use topical progesterone, you can use a patch. So those are generally, and you can use sublingual progesterone too. So there's a bunch of different progesterone routes, but either of them are fine.
Awesome. How do you feel about the pellet form of HRT?
I hate the pellet. Can I say it harder? I hate pellets. I have seen more women get divorced, feel like they have lost themselves, just obliterated by these pellets. Pellets are generally super high doses of hormones. They're generally unregulated and put in by people with no training on hormones whatsoever. Most doctors that I know that are well trained, have education, have been to school, have been to certifications. I go to the conferences I go to that are about menopause, about hormones. None of those doctors recommend pellets, because pellets are generally, it's a money making venture, because you don't have to know anything about hormones. All you have to do is attend a 3-hour course where they show you how to insert a pellet. There's no education whatsoever about hormone levels, who should get it, which symptoms, and nothing. It's just they put in the pellet, and then you're gone for 3 months, 4 months, and you're stuck with that level of hormones. There's no adjusting, nothing. And generally it's like super high doses. And I've just seen so many horror stories, women losing their hair, women who they gained a bunch of weight, they got divorced because they're so angry and irritable. And so, yeah, I've just seen so many horror stories. So I hate pellets. But I still support you if you like the pellet. Who pellets work for is usually younger women who can tolerate higher doses of hormones. And I do understand the beauty and the idea of the pellet. It's just inserted into your butt, small little surgical procedure, and then you never have to think about it again. But the problem with that is that you can't change the dose, right? So if you feel horrible, you're stuck with that for 4 months. And generally you're getting a big rush in the beginning and then it's like sinking down and then you have to wait. And so at the end, you hardly have any hormones left and you have to wait another month to get another pellet. And it's just like a roller coaster. Plus it's a surgical procedure. So you're going to end up with scars all over your butt. So I don't know, a lot of downsides to the pellet, but I still fully support you. If you love the pellet, you can still come hang out with me and I won't ridicule you at all, but I'll be here to help you when the pellet goes wrong.
I've been with Dr. Michelle for 8 years, and you can tell that she cares, and she's attracted women that work with us and for you that are just as caring and kind and compassionate. What happens after the year is finished in the Healthy Hormone Club? Does the price go up?
Actually, no, most of you have watched one of our master classes, or you might have seen some of our emails. We often have sales and specials. And so if you come in on a special price, then you lock in that price for the lifetime of being in the Hormone Club. I think we say for at least 3 years, because when I say lifetime, that's probably not good to say, because like in 30 years, like the dollar is not going to be worth the same amount. So we might have like slight price increases with like time changing, but for the foreseeable future, you will always have the lowest rate and you will lock in that price at the renewal. If you leave and then come back, you may or you may not get that price, but if you stay in the Healthy Hormone Club, we're not just gonna, oh, you came in at 30% off and then we're gonna charge you regular price next year. We'll charge you the same amount that you're paying. So you lock in the rate.
Beautiful. There's such great questions. I've been told that if I was already on bioidentical progesterone and estrogen for perhaps 8 years, I got off of them due to the high cost and did not feel that I was feeling too much better. I asked to get back on them, and my gynecologist told me that it would be dangerous for me to get back on them as I had already on them and quit. Is that true? I'm 60 years old.
That cannot be further from the truth. Even in the most conventional setting, I've not heard that as a misconception. Because usually the misconception is if you've never been on hormones, you can't get on them 10 years past menopause. That was always the statement, because of the issue I talked about earlier with the oral synthetic equine estrogen. When you take that and you haven't had hormones for a while, it can cause issues. But if you're taking bioidentical hormones, you can take those at any time, at any age, which is with that study that Jen shared in the chat. But being that you're already on hormones, like usually even the most conventional doctor would say, oh, that's fine for you to go back on because you were already on them. But yeah, it's just miseducation. She doesn't really understand what she's saying. I would be interested to ask her why. What is the reason? And I'd be interested to know what she thinks the reason is, because there is no reason that you wouldn't be able to go back on, especially if you're using bioidentical hormones. Then there is no like negative issue. I just would advise against oral estrogen, even if it is bioidentical. So you don't want to take estrogen orally. Other than that, you're totally safe to take hormones again. And you said that you didn't feel much different on them before. So maybe it's a different dose. Maybe it's a different delivery method. And maybe working with a different practitioner than we worked with before. Because you should be feeling better. If you're feeling symptoms of menopause and you're on your hormones and you're not living a weird, unhealthy lifestyle, then you should start feeling better. So it's maybe adjusting dosing and working with you a little more closely.
Have you witnessed improved bone density through hormone therapy in women who have unfortunately silently been developing serious osteoporosis?
Oh, yes, we have. We actually had a couple of our Healthy Hormone Club members show us their bone scans that they went from osteoporosis to osteopenia in 2 years, which is pretty amazing. So just the fact that they're not keeping declining is a win, but then to go from a diagnosis of osteoporosis to osteopenia is amazing. Now, I don't see everyone's bone scans, and it does take a good 12 to 18 months of being on consistent estrogen to get that difference in the bone scan. So I should ask for people to share that with me more often. But yes, I have seen it. And there's actually research to show it as well. Consistent use of estrogen replacement does help to improve the T-score. which is how they measure bone density. So you can go from osteoporosis to osteopenia to healthy bones over time. You also do have to make sure that you are eating adequate protein, that you have your minerals, and that you are doing some type of weight-bearing exercise, preferably strength training, but it could be yoga, it could be Pilates, it could be walking. So those components are important in addition to the estrogen, but estrogen is the primary reason. Estrogen loss is the primary reason for osteoporosis. And so replacing it is going to be super effective.
Okay. A replay for this coming by email afterwards to everyone on Dr. Sand's list.
We are going to send the replay to everyone who registered for sure. And it's going to be 2 replays now because I got kicked out the first time. So it'll be 2. I'll edit it together so it doesn't seem like it's 2 videos. But yes, it would definitely, everyone who registered for this will get the replay. And then I probably will post it on YouTube as well. So everyone will have access to it.
Okay. My mom had a hysterectomy years ago and has severe hair loss. Do you have a supplement for this or hormone replacement?
I would definitely recommend hormone replacement. Unfortunately, it should be standard of care for immediately after hysterectomy for women to get put on hormones. If there's a full hysterectomy where they're removing the ovaries, like it should be immediate because you go from normal reproduction to immediate menopause as soon as the hysterectomy is over. Yeah, I would definitely recommend hormone replacement therapy for her. Even low dose can really be helpful. Now, how long ago did you say it was? Did you say? Jen?
I'm sorry, Evan's having a
Oh,
mousetrap emergency.
a
Something's going
mousetrap
on with his.
emergency.
Yeah, I'm so sorry. What was that? What was your
How long
question?
ago was the hysterectomy?
It didn't say.
Oh, it didn't say.
No.
The longer ago it was, the longer it's going to take for like the symptoms to like especially hair loss. Hair loss does take a long time, and stress is also a reason for hair loss too. So the good news though is hormonal hair loss, stress related hair loss, those do come back. And then when you replace the hormones, when you get rid of the stress, it does come back. It does take 3 to 6 months of you, like from the time that you start implementing the changes for the hair to show, because hair is like a 3-month growth cycle. So it does take some time, but what you will see is you start to see these little baby hairs. Like I have little baby hairs right here. Like these hairs are not like, where did these come from? This is like regrowth. That is from like hormones, but it's also because I'm testing a new hair repair serum, which we're going to have out probably in the summertime, which is like for hair regrowth. Yeah, so it's pretty
I'm so
excited.
excited.
Yeah, so I have the one that works now. So formulation process for the hormone creams, any products that we have at Glow Natural Wellness, we painstakingly test over and over again. And then we have little trials and microbial tests. It's a big undertaking to launch a product, but I'm trying to definitely fill the needs that I see. And hair loss is such a big one for women. And some women may choose to do hormone replacement. Some women may not want to do hormone replacement, or they might be doing hormone replacement and need a little extra kick. That's definitely something that we're working on. So stay tuned for that.
Beautiful. Okay.
Do you have to go, Jen? Because I know you don't have to stay on all night.
Okay.
I can answer the questions there in the Q&A now.
Sure. Okay.
And then I'll probably stay on for another 20 minutes or so. And then I feel bad because I lost the Q&A, but you can send me that Q&A. And I'll try to do another one of these next week for any other questions that we missed, but I'll stay on and answer some more questions. Awesome. So I'm going to let Jen tend to her son because she's been working all day. And so I'm going to answer the questions that are here in the Q&A right now. And then we will do another one of these. I'll send out the information on Monday when the next one's going to be. I am out of town Monday through Wednesday, but I'll try to either do it Thursday or Friday, or maybe Saturday. Maybe I will do a poll to see when you guys want the next Q&A. Awesome. All right. How can I tell if I'm going through menopause early because of an imbalance in my body or if it's healthy timing? I'm 46, Hashimoto's, anemia. Would the blood test show hormones and metabolites? Give me the answer. It won't really give you the answer. It'll tell you. So any hormone testing will tell you where your hormones are at right now, but won't really tell you if you're going through menopause. It's not really like a menopause test. You can do luteinizing hormone, you can do follicle stimulating hormone and get an idea if you're probably in menopause, but it can also just be a lull in your hormones. Menopause, going through early menopause is not necessarily due to an imbalance. It could just be hereditary. Some women are just going to naturally go through menopause earlier, and some women are going to go through later. It's not necessarily a measure of how healthy you are. So it's not like a woman who goes through menopause at 54 is healthier than the woman that went through menopause at 50. Don't feel like that's something that's even really in your control. So I don't think that you really need to. I mean, wish that we can't tell. Like, there's no prediction. It's not like you're going to go through menopause in 2 years and you're going to go through menopause in 4 years. I wish we can do that. We really can't. So there's not really it's not related necessarily to your health. Now, there is some things that can make you go through menopause earlier, but it's generally just predetermined, like genetically. See, how can you explain hyperplasia and its negative effects? How do you naturally fix it? That is like a big topic. So I think I'm going to save that question to do it justice and maybe do a video just on hyperplasia. I don't want to answer that in 2 minutes. Stay tuned for that. Do you take referrals if I sent some of my female clients to you? We definitely will. We love referrals. So we would definitely love to help your clients and give them special treatment. We send them over. So definitely reach out. You can email, you can either reply to any of the emails that we send to you, or you can email Dr. Michelle at glownaturalwellness.com, and we'd be happy to accommodate your clients and maybe take some special care for them. See, do you have any thoughts on red light therapy? I love red light therapy. So I actually have 2 different devices here at my house. I have a face mask that I can just wear and walk around the house with it. So it's great for your skin. I also have a panel that's a flexible panel. So red light therapy is great for hair regrowth. It's great for pain. It's great for energy levels. So I really love red light therapy. It's awesome. It's going to help with so many different things. So yes, red light therapy, like I said, hair loss is great, skin health, joint pain, mitochondrial health, just repair overall. 10, 15 minutes a day does the trick. So I actually wish I did it more. I always forget sometimes, but I'll do it like when I'm doing sauna. It's awesome. So there's many different devices online and more these days that you can get. There's one that I like by Therasage. THERASAGE. That is the flexible panel, and you can put it next to you. You can put it on your chest. You can put it over like aches and pains. You can lay on it. So I really like that one. It's portable. It's lightweight. It's convenient. And then the mask I have is by Higher Dose. Higher, like high up, Dose, DOSE, Higher Dose. That is the mask that I have. There's many on the market. I have no affiliation with these companies, but I did do the research, and it has the correct lumens and the correct everything. Those ones are 2 that I like, but there's plenty other brands that are great. Let's see, any feedback. There's definitely a risk that everything was lost from the first half. No, I definitely saw while I was waiting to come back on, while I was waiting for my internet to come back on, it did save the recording. So don't worry. Let's see, I've noticed 2 or more organizers on Zoom calls recording simultaneously. No, we didn't lose anything. Thank you though for your help. It's automatically recorded to the cloud as well. So we'll be good to go. So thank you. But that is a good protocol in place. Jen was here also just to make sure. That's why I had Jen on, but it's over 2 hours now. So I was going to let her make dinner for her son, because we are not slave drivers here at Go Natural Wellness. Awesome. But thank you so much. You're super helpful. I don't know your name because it's coming off as anonymous, but you are super helpful. And if you're looking for work, we'd love to have you on our team because you're great. Awesome. All right. I'm 64 years old. Would bioidentical hormones be helpful and safe for low libido? I did pellets for a year on 55. Yeah, bioidentical hormones are great for low libido. Also, estrogen and DHA are great for low libido as well. And there's some herbs that are really great for low libido. Ashwagandha is one of them. Melatonin is actually one that's studying in menopausal women to help with libido. We actually have a libido support supplement called Venus, and has a bunch of different herbs like tribulus and epidyrium and a lot of different herbs to help with maca, to help with libido and energy as well and drive overall. So a lot of people think, oh, why do you have a libido support supplement? Is that really necessary? I take it every day, not just for libido, but also it just helps with like motivation, drive, creativity. So I really think like our libido overall, like your libido, when you think about it, it is just like your energy, your drive, your passion, right? And so that can transfer into things other than sex, even though sex is great. So we like it, but the bioidentical hormones can totally help. And then there's some other tricks of the trade as well. Awesome. Thank you for thanking Jen. I will let her know. Let's see. I have issues absorbing transdermal progesterone. My levels are low. My doctor put me on sublingual. It helped the levels a little bit, but the taste of the troches is strong. Do you have any recommendations to get progesterone besides the pill? Or we actually have a sublingual progesterone oil that's available both in the Healthy Hormone Club, but also available on our website. It's called Pro Drops. So it is progesterone, MCT oil, and vitamin E. There's no taste really. You can put it under your tongue and it works really well. You can also use it as a topical oil, which can sometimes for some people who don't absorb the cream well, the oil does absorb even better. And you can put it on the bottom of your feet. You can put it on your neck. You can put it on your arm, or you can use it sublingually and it really doesn't have a taste. So it's great. And the troches can be strong because they put like a mint kind of flavor in it and it's really waxy. So that's why I did a sublingual oil. And so we're going to be doing sublingual DHEA and estrogen as well. I'm just making the labels right now. Super clean, super simple. And so that's an option as well. There's also the IUD, right? So we talked about that earlier, intrauterine device. Those tend to be synthetic, so I'm not a huge fan. And then there's also a patch. Not really progesterone, they don't do the patch that much. It's more estrogen. Yeah, so those are I would say the sublingual oil, I give that a try. Is bioidentical cream okay when someone has skin cancer issues? Yeah, absolutely. It does not affect skin cancer at all. So there's no contraindication there. Let's see. I've always had great metabolism, gained minimal weight with my first pregnancy, and the second with twins, and lost weight easily. Awesome. However, while I've had really good body type, I'm definitely gaining in the midsection only, which I've never had. I try to be conscientious about my gut health, homemade kefir, walking, on and off healthy diet, mindfulness, but I cannot for the life of me reduce bloating around the midsection. My extremities are still muscular in tone, but have an overabundance of hair and healthy nails. But my skin is dry. I take Simplex, standard process, vitamin B, a bunch of supplements. I'm reading them, but I'm just not going to read them all out loud. But I still need bioidentical, specifically the vaginal types. Would love some guidance. Okay, so weight gain around the midsection is mostly due to androgen dominance, meaning too much testosterone in relation to estrogen. So it doesn't mean you have high testosterone. It means you have you have a higher level of testosterone in relation to your estrogen. So the dry skin and the belly fat is generally estrogen and bloating too. I would definitely recommend at least a low dose estrogen replacement topically. And then for vaginal hormones, definitely Glow Below is going to be awesome. It's pH balanced, it's got hydration, and then it also has the long-term benefits of reversing atrophy, improving urinary tract health. So those are the two I would definitely recommend. Awesome. Oh, thank you, Kathy. Yeah, I understand that some people don't really, maybe aren't like happy with like how we do things at the Healthy Hormone Club, or maybe they don't like me particularly, but it's okay. We love everybody and everyone's entitled to their opinion, but we only can do our best. And we do put our customers first. You'll notice even before you could become a customer, if we have a sale on something and then you email the next week and I missed the sale, we're going to give it to you. We're going to honor, we're going to understand. We treat you like a person. And I try to treat everybody like you're my mom or my best friend, like how I want people to be treated. And sometimes we do, like, things can happen. Packages can get delayed. Something can be shipped to a wrong address. Things can happen. We are not robots at Glow Natural Wellness, so mistakes can definitely happen, but we will do everything in our power to make sure that we treat you well. So thank you for your comment. I appreciate you. Is it possible to buy bioidentical creams without the monthly club fee? Right now, we don't have that availability because we want to give you some guidance around your hormones. However, we do offer the progesterone drops without being in the Healthy Hormone Club. So that is one that we do have available. We do offer the vaginal estrogen, the vaginal DHEA. However, please note that the vaginal estrogen and vaginal DHEA are not going to give you the systemic benefits for the bone health, the heart health, the brain health, the rapid aging, like all the things, the hot flashes, the sleeping, the libido. We try to make the Healthy Hormone Club super affordable so that you're getting your hormone creams, you're getting testing, you're getting unlimited support, you're getting visits with the clinicians, you're getting the lifestyle support, the coaching. We try to make it affordable to where it wouldn't even be more economical just to buy the creams, but we really want to give you guidance at this point in time. And in the future, might we offer hormones without being the Healthy Hormone Club? I don't know. It's working right now. We really like to give people the support. So what I don't want to do is sell hormone creams and then people use them incorrectly and then think that hormones don't work for them because there was no guidance. And that's why right now we don't offer that, but we do offer the progesterone drops because we have you start low dose and then gradually titrate up based on your symptoms. And then we recommend not like using a certain amount. And then if you do think you need more, get a hormone test to see. So hopefully that's helpful. Thank you. I quit my hormones about 2 years ago. My doctor said I might get cancer. I'm sorry, I'm like laughing a little. It's not, I'm laughing at your question, but I'm just like, I just can't believe like the research is so clear and the information is out there. In 2002, there was a Women's Health Initiative study. And this study was done on lots and lots of women, and they were testing the benefits. They were trying to prove that using estrogen replacement was actually protective for heart disease. But they were using oral equine estrogen, so conjugated equine estrogen, which is estrogen from horses taken orally. And they were using medroxyprogesterone acetate, which is a synthetic progestin, not progesterone, both oral. So it was Premarin and was it Provera? It's two different ones, Premarin and then the medroxyprogesterone acetate. So they had two different arms of the study. One arm was they only took the horse estrogen. The other arm of the study was they took the fake progesterone, the progestin, and the horse estrogen, all oral. But that was what was prescribed at the time a lot of times. And they immediately stopped the study and they're like, oh my God, hormones cause cancer, hormones cause heart disease, and all this like press happens. There was in a newspaper, it was on the news, all over the place. 2002, hormones cause cancer, right? And so immediately doctors pulled their patients off these hormones. But what happened was the study wasn't even complete and the write-up wasn't even fully written. And when they actually looked at those results, the women on the estrogen actually had decreased cancer and decreased heart disease. It was the women on the synthetic progestin that had all the issues. And so the issue is the synthetic progestin. And this has been well documented 5 years later, 10 years later, even recently. But doctors are still referring to that pre-published media frenzy that's what they're referring to. And it's crazy. And it's on horse estrogen and fake progesterone, not on progesterone and not on women's human estrogen. So it's crazy. Anyway, but that's why they're saying you might get cancer, even though estrogen has never been proven to cause cancer. Even the oral horse estrogen actually had reduced rates of cancer. So it's crazy. That is what people are still saying. Anyways, now you have the information. Please excuse my ignorance, but what exactly are these bioidentical hormones made from? Not ignorant at all. Oh my God, great question. Bioidentical hormones are made from plant sources. They can be made from either soy or the wild yam plant. And so what happens is in a component of these two plants, there's a component called diogenin, and diogenin has the same chemical backbone as our hormones, estrogen, progesterone, testosterone. So if you remember chemistry class, there's a bunch of octagons that are stuck together in these different patterns, and then they have tails coming off and sometimes little circles coming off. And that is the chemical structure. And so diogenin happens to have a very similar chemical structure, has the same backbone, the same octagons, and it has some extra little things coming off. And so they take that diogenin into the lab, they remove some of the hydrogens and the carbons, and what they're left with is bioidentical progesterone, bioidentical estrogen, bioidentical testosterone, bioidentical DHEA. And so that is what the hormones are made of, the USP, United States Pharmacopoeia certified hormones. So that's what they're made of. Now, different formulations, there's some oral estrogens that have peanut oil in them, or that have some of the hormone creams from different pharmacies might have EDTA in it, or some chemicals that help it absorb. Our hormone creams at the Healthy Hormone Club are natural. They have no preservatives. They have all healthy ingredients that are deemed safe by the Environmental Working Group, healthy all the way around. So not a dumb question at all. I think that's a great question. And so in my hormone restoration masterclass, I do break down this in detail and explain exactly where hormones come from. So if you have not seen the hormone masterclass, you can always view the next session by going to our website, fixhormones.com, and then clicking on the resources, and there's the free hormone masterclass, and you can sign up for our next one. It's a great resource for really explaining a lot of this information. Awesome. Oh, you're so welcome. I love being able to hang out with you guys. What are your thoughts on the 10-year window of opportunity using the estrogen pill for people with hereditary osteoporosis? The 10-year window is because of the oral component of the fact that when you take oral estrogen, then so I explained this earlier, but let me go through it again. So when your hormones decline, so when you hit menopause, you're without estrogen, right? And so every year that you're without estrogen, you develop some damage to your blood vessels, and you develop some plaques in your blood vessels because of the inflammation that is increased with the lack of estrogen. So then when you take oral estrogen after 10 years of having this damage done, then the oral estrogen releases something when it's metabolized in the liver. There's an enzyme called MMP9 that's released from oral estrogen. And what happens is that MMP9 can actually cause some of that damaged plaques to break off and then cause things like stroke. And so that danger is not there when you take topical transdermal estrogen. And so that's why you want to use topical transdermal through the skin for estrogen. You can also do sublingual, but even that, some of that you're going to swallow, and that can cause some issues. So I recommend topical estrogen. You can use a patch, a cream, an oil. Vaginal estrogen is also fine, but vaginal estrogen is not going to do the systemic benefits. It's just going to stay local to the vagina. Awesome. Hopefully that helps. And if you don't understand, if I'm saying this and I'm speaking fast because I'm trying to answer a bunch of questions, but if you want me to go dive deeper into any of these topics, let me know. But I do have a YouTube. Let me see if I can pull up my YouTube channel. I can put the link to the video. I have a video specifically on this topic. So my channel is called Fix Hormones with Dr. Michelle. Uh-oh, it's playing. So let me see. So I have this one here. This is the 10-year rule video. So let me just share that. Copy link. So I'll put this in the chat here for you guys. So this is the 10-year rule one video. It's 10 minutes. It's short. It's not a super long one. Some of my videos are super long. And then I have, this one's the video about the blood clots too. This one's a good one too. copy. And I'll put this one in the chat too. Oh, wait, hold on. I didn't do that. I sent it to everybody. All right, so this one's the blood clot one. And then this one is the 10-year rule one. Share, copy. All right, so I'll put these two in here for you guys. Then that way it's giving you a little more information. But if you just go to Fix Hormones with Dr. Michelle on YouTube, or just type in Dr. Michelle Sands on YouTube, you should be able to find my channel. And it definitely helps. Oh, Sue, no worries. I'm glad that you asked the question about making sure that we take care of people and the concern about some negative reviews you might have seen, because it's important to know that. And I'm glad that you asked, because I'd rather you ask than you just not ask and just assume that we're not doing what we should be doing. But yeah, definitely, like, we are here to support you. And we do that. I really do this because I love helping women. And everyone in my team shows up and they're excited to help. And we just really have a very nurturing team. We've developed so many amazing programs, and just we have a great, our customers are amazing. Everyone in Healthy Hormone Club is amazing. And so we do our best to help. And so I think you'll have a really great experience. And thank you for asking. Thanks for being here tonight. Awesome. Awesome. See, can I take BHRT if I have BP? I've been also told I have too much fat in my blood, so my cholesterol's out of balance. In addition, I got my annual test, which also shows borderline prediabetes. Not in my wildest dream have I ever imagined having all these issues. I want to get my health back on track and want to work with a reputable doctor, informed, who is not going to push his own agenda. Sincerely and wholeheartedly want to make other people's lives better. Awesome. That is exactly what you should want. Now, I understand it sucks to have all of these things happening. And yeah, none of us ever dreams when a little girl, like, I want to grow up and have diabetes, but things happen. And one of the things that happens when we go through perimenopause and menopause is we become less resilient. So we become more apt for our cholesterol to rise. We have more inflammation. We are more sensitive to sugars. We become more insulin resistant. So a lot of these things definitely cause issues. And topical hormones, not oral. You don't want to do oral hormones, at least not oral estrogen. Oral progesterone, you can, but topical transdermal hormones, bioidentical, is going to be super helpful for you. Not only are they going to give you more energy, they help control inflammation, help with your cholesterol, help with your blood sugar. All these things are going to be helpful for you. And then not just the hormones though. So if you do join us in the Healthy Hormone Club, we're going to give you help with your nutrition. We're going to give you at-home workouts that you can do. We're going to give you breath work. We're going to help you with your pelvic floor health so that you don't have urinary incontinence or pain. We're going to help you with detoxification, like so many things. And we're constantly adding more things that we need to talk about, things that we need help with. And we have these monthly calls like this, but more of a meeting, like a town hall where we're all talking to each other. Last month, we just did a whole pelvic floor class with Dr. Jasmine, who is our in-house on staff pelvic floor therapist. So we have a lot of great resources for you in the Healthy Hormone Club. But even if you don't join the Healthy Hormone Club and you find another doctor that you want to work with that cares, definitely hormones are going to help you, but the lifestyle piece is equally as important. So as a naturopathic physician, I wrote a whole book called The One Behind Me, Hormone Harmony Over 35. That book is all about the lifestyle. It doesn't even talk about hormone replacement, because the lifestyle is so important and it's something we can all do right now without even taking hormones, but the hormones super help. So that was over 35. So that was like before you hit menopause, but the things in that book still help you in menopause, but also you need to take the hormones too. So hopefully this is helpful. All right. It is 7:40. I am going to go ahead and end it here because I lost Jen and these are all the questions that I have. I do have access to those Q&A questions that you guys did type in. before my internet shut off. So I will go through and answer those either in a separate video or via email. And also, if you do have questions, you can email more questions in, or you can DM me on Instagram. So Dr. Michelle Sands on Instagram. I do answer every one of my messages there. And so feel free to DM me. I might even video you back with the answer, or I can type questions back to you or answers back to you. And let me know how I can help you. If you are watching this replay and you need some help and you want to join the Healthy Hormone Club, but you're just not sure, you can actually go to our page, fixhormones.com, our website, and then the join page. So if you go to fixhormones.com/join, let me just put this, oh man. Yeah, and you hit join. If you go to fixhormones.com and hit join, if you scroll down the page, you're going to see everything that's in the Healthy Hormone Club. But if you scroll down the page, there's actually a link to book a consultation. If you're just not sure, you just want to get more of your own questions answered one-on-one, you can totally do that. We have a team who is there to support you, answer all your questions. And if you just need more help, we are happy to work with you, give you all the information. And then even if like you need just the peace of mind to know it's right for you. So you can totally do that too. And then, like I said, always reach out to me. You can go Dr. Michelle at glownaturalwellness.com. You can get me on Instagram at Dr. Michelle Sands, or you can always reply back to any of the emails that we send. And I'm happy to help you. And stay tuned. I will send the replay out on Monday. And then I will also let you know when the next Q&A is. And if I can support you in any way possible, please let me know. Thank you so much. Have a wonderful day. I will talk to you guys soon. Thanks for spending some time with me tonight. Bye-bye.